PetWellnessAcademy.com. I am Dr. Katie Kangas, and today I would like to discuss the topic of bad breath. Well, bad breath is not normal in dogs and cats, and many people may not realize this. It's actually a symptom of dental disease or oral disease that involves gingivitis and plaque and bacteria. In fact, the plaque and bacteria, which you may recognize as tartar or the colored dark substance on the teeth, plaque and bacteria is how dental disease initiates. The plaque and the bacteria in the mouth lead to gingivitis. They irritate the gums, and the body's response is inflammation of the gums. This gingivitis is actually the initial stage. If this is left unchecked, it leads to periodontitis or periodontal disease, which involves the deeper structures, the supporting structures around the teeth. This poses a significant health risk because periodontal disease is known to affect the rest of the body. The chronic inflammation of the gums, which can be painful as well, allows bacteria access to the bloodstream and allows it to travel to organs that are significant to the health of the body. We know that periodontal disease is linked to many different health conditions, including conditions that involve the heart, the liver, the kidneys, the lungs, and even the joints. So the cornerstone of managing this is with dental hygiene. The best way to do that is with daily home care, brushing your pet's teeth. If you cannot achieve that on a routine daily basis, it's very critical to do regular professional cleanings with your veterinarian. Regular professional cleanings are only useful if they involve anesthesia because it is very important to get under the gum line. It's actually the plaque and the bacteria at and under the gum line that cause the problem. If anesthesia is not used and you're only removing tartar and plaque off the surface of the teeth that is not at or under the gum line, it does not serve a medical benefit, but only gives a cosmetic benefit. It's also important to know that providing dry food does not do anything to clean the teeth. Dry food might crack off a little bit of tartar or remove a little bit of plaque on the crowns or the points of the teeth, but the part that really matters to the health of the animal is at the gum line and under the gum line, and dry food does nothing to address this. There are many chew toys available to help with dental home care as well, and in fact this is termed passive home care as opposed to active home care, which would involve brushing the teeth. But one of the things you want to make sure you evaluate is the safety of these for your pet. In fact, the rule of thumb amongst veterinary dentists is that if a chew toy cannot be bent or indented with your fingernail, it's not safe for the pet because they can break a tooth on it. These are too hard. There are many passive chew toys that are marketed for dental health that are actually not safe and can risk fracture of the teeth. So this is very important. One way of knowing the validity of the product is to look for an approval or a seal from VOHC. That stands for the Veterinary Oral Health Council. When you see the seal of approval, you can feel confident that this product has been evaluated by veterinary dentists to be effective for the removal of plaque and tartar. That, however, does not correlate always with gingivitis or inflammation in the gums. One key component in my protocol for gum health is a product called 1-TDC. This is 1-tetradecanol complex and is a unique fatty acid that has a special affinity for the gums. And I have seen very fast results with it. In fact, it's used by many veterinary dentists to support gum health because of its efficacy. Thank you for joining us today. Tune in again real soon so that we may share helpful information and tips on how you can keep your pet healthy and happy right here at PetWellnessAcademy.com.